Dermatin Anti-Fungal Solution is an antifungal liquid which stops the growth and spread of bacterial and fungal cells that infect the skin. Formulated with 1% Clotrimazole, this medicated liquid is used to treat a variety of skin infections such as athlete's foot, Jock Itch, and Intertrigo. Unless otherwise prescribed, apply a thin layer of Dermatin Anti-Fungal Solution to the affected areas 2 to 3 times per day and rub in gently. For fungal infections of the skin, 3 to 4 weeks of treatment is usually sufficient. In the case of athlete's foot, treatment with athlete's food liquid treatment should be continued for approximately 2 weeks after signs of infection have disappeared in order to prevent recurrences. An effective liquid antifungal solution, which contains a broad-spectrum antifungal agent, Clotrimazole. It fights against dermatophytes and yeasts associated with fungal infections. Preventing fungal infections. It's important to follow good hygiene practices to prevent fungal infections, stop recurring fungal infections, and to prevent contagious fungal infections from spreading around your body or to others. General hygiene rules apply, such as washing regularly with soap and water, making sure you fully dry yourself off after washing, wearing clean clothes, and washing your sheets and towels regularly. How to use. Clean and dry the affected area thoroughly before application. Apply Dermatin Antifungal Solution sparingly over the affected area and rub in gently, 2 to 3 times per day. Symptoms should clear up in 2 to 4 weeks. Continue treatment for 2 weeks after symptoms disappear to avoid recurrence.